It occurs to me that not everyone here knows you, Hannah, and that you could do something very quickly about this sad situation by telling people a little about yourself. Could you do that?
Sure. So, for those of you who don't know me, I actually grew up at this church. My parents are John and Cynthia Meredith. So I spent my teenage years here and through uni. And after studying arts and law at Adelaide Uni, I moved to Canberra and worked for the government there, and then moved to Central Australia and worked in Alice Springs for a number of years, working out in the remote communities, working with women and children who are experiencing domestic and family violence. And then I moved to work for a legal service supporting people with the Royal Commission into Child Abuse, both in Perth and in Sydney. And then a couple of years ago, in that time I met my husband Andrew and had our two girls, Adelie and Ayla, who are here. And then in, now I can't remember, in about January 2021, we moved back to Adelaide and we live in Upper Sturt. And 8 months ago had baby Hunter, who you can probably hear, who's munching through a biscuit at the back there.
That's a pretty remarkable CV, Hannah. We're blessed to have you here. Can I ask you, you're going to be talking about Maranatha Health today. Can I ask you when and how you became aware of Maranatha Health? Yeah,
well, funnily enough, I remember as a teenager, Michael actually talking about how he was going to study medicine and start a clinic in Africa, which I think I remember because I was very impressed with, because from someone who didn't know what they'd study at uni, let alone what they'd do as a job, to have that kind of vision, it's pretty amazing. And then I guess always hearing about Maranatha Health coming back to Adelaide and visiting, and then I think it was when I was in Sydney and I was on parental leave and was talking to Karen Baker, who a lot of you would know as well, who used to be here, who's actually the chair of the Maranatha Health Board these days, since earlier this year. And she was talking about Maranatha Health and said, I should get involved too. So I spoke to Kim, and that was when I heard a lot more about Maranatha Health. And I think that was when I sort of thought a bit about, I guess, what I did in the work in my career, in working for not-for-profits, but also working out in Central Australia in the remote communities. It's those of you who have any connection or been out there, it is a very different world, I guess, to what we have in the cities here. And I think I could see some parallels in the work that I did in Central Australia, some of the complexities of supporting people and helping people where there's so many other issues around poverty, health issues. Of course, where I worked, there was a lot of issues around safety. And so it seemed to me, and then of course the cultural complexities as well, the cultural differences for our Aboriginal people in Central Australia, it's quite different to here, and us coming from my perspective in Alice Springs was that I was working with government funding to try and provide support services and legal services, and how you do that in a way that is appropriate for people and that actually makes a difference is pretty difficult. And talking to Kim, I could hear that there were some parallels, and so I said to her, perhaps would you be looking for someone on board? And she was very interested. Also got, of course, a legal background, so that often is of interest on a board, but also working in the not-for-profit space and then having that sort of cross-cultural experience here in Australia rather than internationally. So, yeah.
Fantastic. You've anticipated my next question, which was, why did you get involved? So, ladies and gentlemen, I give you Hannah Ferrari.
Thank you. So I guess first I just wanted to talk first a bit more about why I'm involved and why I do that. I think, it was pretty clear quickly how the work I've done, not internationally, but here in Australia, that I have some of those same interests in supporting people who are vulnerable and who are living with disadvantage. And so, yeah, that's how I became involved. But I think a good perspective to remember from, we're looking at Matthew 25, where Jesus, the parable says, then the king, verse 34, then the king will say to those on his right, come, you who are blessed by my Father, take your inheritance, the kingdom prepared for you since the creation of the world. For I was hungry, and you gave me something to eat. I was thirsty, and you gave me something to drink. I was a stranger, and you invited me in. I needed clothes, and you clothed me. I was sick, and you looked after me. I was in prison, and you came to visit me. Then the righteous will answer him, Lord, when did we see you hungry and feed you, or thirsty and give you something to drink? When did we see you a stranger and invite you in, or needing clothes and clothe you? When did we see you sick or in prison and go to visit you? The king will reply, truly I tell you, whatever you did for one of the least of these brothers and sisters of mine, you did for me. So for me, that's an important verse when I'm thinking about the work that being involved with Maranatha and the work that we do. And I think, it's when I look at Maranatha and I look at what can be achieved and the impact that a small organisation makes so many people, and I will show you some of the impact that we've had. That for me is just astounding that we can have such an impact and such life-changing work from here in Australia through the work that Maranatha does. So for those of you who know, if we could just go to the next slide, thanks. So for those of you who perhaps haven't heard of Maranatha, I assume lots of people have, but Maranatha Health is in Uganda, located in Uganda. Has a medical centre, a clinic in Fort Portal, which is in the Karaboli district of Uganda. So the centre specialises in paediatric care, providing inpatient and outpatient services. It also is a base for sort of capacity building work and community health programs. So this, I think, when I first heard about Maranatha Health, I thought was really exciting, having done this sort of work myself in terms of community development, community capacity building work. I think it's so important that this sits side by side with primary health care, is that preventative work is there too, the education, the things that we, I guess, can take for granted, where we have good access to healthcare and good access to services, that's not the case. And so it's a really important part of the work that Maranatha Health does, working closely with communities, being invited into villages to work with the community around what support they would need around what health initiatives. So some of the work that they do with that is educating people about accessing healthcare in a timely manner, prevention of common health issues such as malaria, which we know is a big issue, in HIV, and the importance of safe drinking water and other sanitation and hygienic issues. So, that is a bit about our mission, of course. If we just go to the next slide, thanks. So here's the team. Currently there are 42 staff, and all the staff are Ugandan. So that includes the staff working in the clinic and those in the community building programs. So the staff, about 80% of Uganda's population is Christian, and so it's reflected in the staff as well. And our staff meet daily for devotions and prayer. And the staff bear witness to God's love through their care of and their love for people who come to the clinic, but also through the policies of the organisation too. So the team's role is to provide the healthcare, but also counselling and health education that families can turn to when their things are difficult when they arrive at the clinic or they engage with the with the community programs. So if we just have a look at the next slide, we have a look at some of what we have achieved this year. So here's this breakdown of the 42 staff. And the exciting thing to have first Ugandan doctor, part of what Maranatha Health does as well, is support people, Ugandans, to train as doctors and other health staff, so that's very exciting. And the other exciting update is that recently, over the years, Maranatha Health has always had international doctors coming to work long and short-term placements, to work alongside staff in Uganda. And with COVID, that of course became quite difficult. And so there hasn't been a lot of that. But just in the last month or so, there's been quite a bit of interest. And looking at perhaps 3 doctors going over there from Australia, New Zealand and the UK to do short and long-term placements. So that's really exciting. Because it's a great way to sort of bring more knowledge and to help support our Ugandan team and train them up. So, yeah, that is the team. If we go to the next slide, we can have a look at the impact over the clinic itself. So the clinic's seeing over 1,000 patients a month, as you can see, almost 16,000 lab tests. So, as we would know, this is an important function of a hospital and clinic, is that we're able to run those tests. And funds needed to support that side of things, as well as the face-to-face patient work as well. The running of Maranatha Health is about 33,000 Australian dollars per month. And of that, about 22,000 comes from Australian donors. So thank you for your support there, because that, we see that go directly into running the hospital. The balance comes from patient contributions. So where it is possible, people do pay to come to the clinic, but of course, we're not turning people away if they're unable to pay. So looking at people being able to support that work. And part of that is Maranatha Health standing out as a best practice provider of healthcare in the country, so that people who can pay want to come to Maranatha too, and having that capacity as well. If we just go to the next slide, we're looking at the community and holistic programs. So this includes, if you have a look, there's the health and nutrition classes that are offered on the ward. So that's a really important part when people come in with their children, that they're able to, their children are helped, but also some education to parents to try and prevent some of these issues. Think about things like malnutrition and those sorts of issues that we know can happen very quickly for small children and babies. But also then the program that goes out into the villages. So a village might invite the community health, the community health workers in to work with that village. Part of what they do then is train what's called community health advisors. So you look at 162 up there. So training those advisors in the areas that the community has identified. So we're talking about sanitation, building latrines, washing hands, all those kind of basic things, but also seeking healthcare and those things. So it's the train the trainer kind of method, but yeah, it's about increasing the impact they can have in a village by training, identifying people who can be ambassadors, can be advisors, and then they work with their family and friends. So that's where we talk about 2,175 families impacted. So that's a lot more people than just 2,100. So yeah, that's it. I think some of the challenges can be when going into villages where there's entrenched traditional practices, so that that's some of the work that needs to be done. And I think also people have, where there's other difficulties in people's lives, we're thinking about poverty and other social issues. It can be a difficult thing to work with people around changing some other practices when there's a whole lot of competing issues that impact people. So it's a really important program where people work one-on-one and have a really good understanding of what is happening in that village to be able to affect change. So this is all lots of numbers. What's really important is to talk about people's stories. And so if we just go to the next slide and we talk about Afia. So Afia is the baby there, and she was 1 when she came to the clinic. And she often was sick and she hadn't gained weight for 6 months. I have a 8-month-old baby who had some weight issues, and we were weighing him every week for a very long time. So, I'm well aware of the real concerns that we have about small children not putting on weight. So she was suffering from high fevers and convulsions, and her condition worsened. So her mother brought her to the clinic, and she was actually admitted with severe malnutrition and malaria. So while she was being treated, her mother was taught how to prepare a variety of foods to create a balanced diet, and was advised to use what was in her meals to help boost her immunity. And then her health was monitored at post-discharge appointments, with continued reiterated health and nutrition education for her mother to support her mother. And then after only 1 month, she was followed up with an in-home visit, and Afia was found to be healthy and her weight was matching her age. So that's pretty exciting, and you can see what her mother said in terms of the blessing that it was, and thanking Maranatha Health, and knowing that things would have been very dire for her daughter had she not been able to. So there's many stories, but that's just one from Afia. And if we could just go, so we have a message, just like to show a video from Sabiti, who is one of the executives on the team at Maranatha Health Uganda. Now, some of you may have seen this in our supporters. We had a supporters brunch, afternoon tea, I think, last year. So you may have seen this, but I think it's really great to hear directly from Uganda and from the team there. So.
Okay. My name is Sabit Fenekans. I work with Maranatha Health Uganda as a member of the executive. I want to bring greetings to you from Maranatha Health Uganda, from the executive team, from the management team, and from the entire staff of Maranatha Health in Uganda. We want to thank you for the continued support that comes from you people of Australia, the support that makes our work possible. And I want to inform you that our programs are working well, both the clinic and the community health programs. We have recently added on more staff, both to the clinic and the community programs. And now our community program is reaching to 8 communities. And we continue to receive thanks from the community members because of the changed lives, because of reduced illnesses. And we put all this back to you, the people of Australia, because it's your support that makes all this work possible. The clinic continues to be busy every day because of the trust that people have put in us. Dr. Kevin continues to be busy every day. Sometimes he gets overwhelmed by the number of patients he has to see. And equally, our lab staff also sometimes get overwhelmed by the number of tests they have to do. And we hope it's because of the trust that people have put in the palliative care that we give to them. For example, in the last financial year, we have been able to to treat over 12,000 patients, and we were able to conduct over 16,000 lab tests, and our community program has been able to reach over 2,000 households. And we appreciate the good relationship we have had with our government. We appreciate the support we get from the community people, but above all, we appreciate the support we get from you people of Australia. We are waiting in anticipation to going to our new facility And for many years since we acquired this land, it has been a dream of everyone to see the day when we cross to the new facility. Our staff here call it Canaan, the promised land in the Bible. And for example, most of the challenges we face in our service here are take an example of a day when you have to send patients away, sending them to other facilities because our wards are full and we have no more space for them. It is a tough moment in our lives. And also similarly, like now it is a rainy season, and when it is raining and you have many patients who are waiting under the tent and it is very cold, it is one of the tough moments in our services. But we hope the moment we cross to the new facility, all these challenges will be overcome. Maranatha Health is known in Uganda for the quality of its services, for the compassionate care we offer to those who come to us. And this is by the culture of compassion that was started by Dr. Mike and Kim while they lived with us here. And we are happy that this culture has continued, and it makes a brand for us. It identifies us from a number of health facilities in the country. We say thank you for your contributions. We say thank you for the lives we are able to save because of your support. And this reminds me of the story of a man who lived by the lakeside. And one time, the storm brought a lot of fish, millions of fish to the land. And one man started picking one by one, putting them back into the lake. And people looked at him, he looked crazy to them. They even discouraged him, saying, you won't finish them. There are very many. And this guy told them that even if I save the life of one fish, it makes a difference. Similarly, we understand the challenges we are dealing with here in Fort Potro are the same challenges everywhere in the country, and we can't reach everywhere, but every single life we are able to save makes a difference. And we attribute all this to you people of Australia for the support you are giving to us. Pray for us. We have Ebola in the country. It has spread over about 4 districts in the country, including Kampala, the capital city of this country. But we hope one day it is going to be okay. One of our staff, Albert, a medical student who was doing his internship in a district where it started from, got infected with it. It was a tough moment for him in the hospital, but thank God he has recovered well, and now he's here with us working normally. And he's waiting for the lockdown to be lifted from that district so that he can go back for his studies. We want to thank you so much for the support and the love you have for us, and we continue to pray for you that God gives you longer lives, He multiplies your resources so that we can continue with you to do the kind of work we are doing here. We thank you so much, and we wish you God's blessings. Thank you so much.
So that was from Sabiti on the team in Uganda. And that was, he did record that sort of later last year, and they were in the middle of an Ebola outbreak. And just as an update, that has been contained. There haven't been further cases of Ebola, which is answer to prayers. And the team in Uganda wanted to pass on thanks to Knightsbridge for your prayers and your support during that time, because that was pretty scary for them. Thinking also around COVID as well happening for Uganda. And Albert, who Sabiti talks about, who did contract Ebola and as a miracle recovered, he is back at medical school and in his final year. So that's a real answer to prayers and fantastic. So the other thanks, if we could go to the next. Yep, and sorry, yeah, just some photos there. If you could go to the next slide. So also to update you, you can see down the bottom the ute, the new ute. We had just a short fundraising appeal in October last year. The much travelled ute was about to die, and people stepped up here in Australia and were able to purchase that. And I think that again is so important for when we're talking about regional and remote areas. The access to healthcare travel is such a barrier. And so something like a ute, which seems far from sort of hospital running costs, is actually essential to provide the services, because if people can't get there or services can't get out to them, then there's no point having a hospital. So thank you to that, because our supporters stepped up very quickly to be able to provide that. And then the other thing also as part of that fundraising appeal was the oxygen concentrator up in the top there, which has a significance to me, because my baby was on oxygen for the first 7 months of his life, and has come off in the last few weeks, which is great. But we had oxygen bottles for him, but we did also need to access a concentrator towards the end of last year. And here in Australia, that was something that I was able to do: call up, hire a concentrator, and travel with that. But it's just a reminder that that's not something we take for granted here, and that's not something that's available across all of our world. So thank you for that support. That concentrator was very gratefully received and used in the clinic. Sabiti also, if we go to our next slide, talked about the land, the new facility. And as some of you may be aware, this Maranatha Health purchased a block of land in Fort Portal, so we're in the same area that the clinic's now located, in 2018. The facility that the clinic is currently in is a rented building, and it's not built for the purpose of a clinic, and it's fast being outgrown. Even practical issues with space. Kim talked about they're running out of rooms to build latrines in the land that they have. So it is really important that a purpose-built facility is established. You may have, back a few years ago, there were, I know at one of the supporters functions, there were some plans for a new building which had been drawn up. In that time, of course, we had COVID, so things, of course, had to be put on hold. But we are now embarking on the next stage of design. We've working with an organisation called EMI, which is an international Christian organisation that supports not-for-profits building facilities using professionals from around the world, and also in Uganda, to say architects, engineers, building consultants, to build facilities. So we are working with them around the next phase of design and costing. And so then our next campaign, our next project that you'll hear from us, is around raising the funds to build that, because of course we need to continue operating the facility, the community outreach programs, at the same time as building this facility. So we're excited, and we'll be looking for big vision to build that facility. And as you heard from Sabiti, they are very keen in Uganda for that facility. That's purpose built for what we do. So if we just go to the next slide, so we've talked about what we achieved this year, but just thanks to this is an opportunity for me on behalf of our board. I'm actually the chair with Karen as our chair, and then we have Kim Finlay on the board, and Gary, who I know has spoken here as well, and then Joe and Jackson, who are another board members who've been on the board for a few years as well, who have sort of marketing and medical backgrounds, respectively. So it's an opportunity for us to say thank you on behalf of the board for the support that Knightsbridge offers, for the financial support, but also for the prayer support. We have a very faithful team of prayers who meet every month to pray for the work. and also to support us as a board, so that's fantastic. And our volunteering team as well, who are invaluable to the work that Maranatha Health does. It says here, from little things, big things grow. So just to give you an idea, in 2019, Maranatha Health treated 9,700 patients. And then as we saw, 2022, we treated 12,340. And in between that was COVID, of course, which restricted people's access to services and restricted Maranatha Health's ability to offer services as well around various government restrictions and things. There were a number of those in Uganda. So, yeah, I think that is a fantastic reflection of the support that we're offering and the work that the team in Uganda do. That's growing. Also, our community program, it started in 2017 with the first one village and 18 village health advisors who were trained in that village. And now the program has reached 22 communities with 382 village health advisors. So that's from 2017 to now. So we are growing, we are doing lots of work, and there's no doubt that this is changing people's lives, and both for those who needing acute care, particularly for children needing acute care in the paediatric clinic, but also in the preventative and education work as well, to changing lives for people in communities as well. So, yes, thank you on behalf of the board, and we would love to continue the support that Knightsbridge offers. If we just go to the next slide, it just talks about some of the things, amounts of money can achieve for us in Uganda, both in primary healthcare and in our community development work. So if we just want to go to the last slide, because it's such a beautiful photo, if you can see it. But yeah, thank you for the time to come and speak this morning. Thank you for your interest, your care and support, your financial contributions and your prayers. If you have any questions, please come and have a chat, or of course, David and Sandra, who know more than me. And if you've got medical questions, ask them, not me too. It's most definitely not my area. But yes, thank you.